statistic begins from household. From January to date, Michael, in your family, how many people have fallen sick with malaria? Mine is 0. 0, we have not consumed the cohort more than malaria. That is the data we should talk about. Disaggregated data we always get from everywhere, who can come from the camp, cannot help us. Let's go back to our household, to our churches, to our communities, to our cultural institutions. See how we are fighting malaria. That is always what I tell the communities. Believing in the generated one is good, but you yourself, you should produce your own data about malaria. Malaria, when you compare here, we started with the village health team in the communities. They did a commendable work. Then we came to the facilities. They are doing commendable work. We distributed mosquito net. We did the net that move in the communities. The users of net, at the communities, let us use the mosquito net like Comakage.
How best? It's a collective effort, the way Health Assistant had stated it. And by that, we might end malaria. Now that vaccine is already even there, we should have new cases of malaria should be reducing time and again. With the TB, VHTs help us screen. They know it all. Send the people you suspect to be having malaria to the facility. We test them. Our microscope are here lying. We need samples from the community of people. HIV, that I think is a talk of another day. Time has gone, but let's also sensitize people. Let them know their status. We need 0 infection. There's that 95 goal. So by that 2030, we don't want new infection. If those who are infected, we need them suppressed.
Northern Uganda hip hop culture is having an engagement with health facilities and other stakeholders from the district and municipality to find out the existing gaps in addressing malaria, HIV, and TB challenges. And what we found out here shows that malaria generally, it is reducing, because I personally, I take it from my own household. In about 8 months period, none of my children or my family members have ever suffered from malaria. So this shows that truly malaria is reducing. Okay, the messages that I have for everyone, anyone who is out there listening, this fight is not for an individual. Let us take it. It is a collective responsibility. That is why we have the community gatekeepers, like the VHTs, the LC1s, and everyone, the health workers, and even up to the level of the Ministry of Health. So we are supposed to take up these actions, these measures. Like, for example, we have to sleep under the mosquito net, ensure that at least you clear bushes around your home, and then logging waters, at least you pour engine oil on top, so that it reduces the multiplication of mosquitoes in our areas. With this, I say that we can achieve the vision of 2030. No malaria, no HIV, no TB.
Malaria, tie kamete piane, kwat beti chwe, pi mapong, itengang tie ki kar en man me chwili, dano siare pore tim, chino top gang bo bake, be no nyual tiye, chikelo malaria maduong. Medical malaria eno matine kadane, tie me lutiano ma ke kar me chwi koma eni, gen siare poro, kere kumla tien liat kedo mino panadol, entame panadol ene dong, ko kwe liaro, chino dong liar po mete, enen tike lutame malaria, ena dong gen neo ne rachi, no malaria mudo wa remo, dongi ringi mudo ke mere remo, ena dong remo cha dong pelara. Chỉ đúng cái lúc đó, về tiêu và mấy cái tiền mua mà gen nào puliar cho lúc gen là bên nào đàn gen xe này bỏ đó, cái thứ quan VC của nó cái kiến cả em, đúng mẹ thì cùng em này, gen mẹ là cái biên nó canh, gen nào kia thì cùng về đặt ta vào tí mấy giờ riêng chuma, gen vào ở nhà bố đá nó về nó đúng, gen là đó clinic, em clinic xe này chỉ remo, cái đó người mình đôi giờ chơi, gen nó phải theo đôi chơi. Malaria uwe wang remo padano palutiang ke luto ke tawan machalo VSC wano kede madake lokuma ana jo ma tiki gen tiki TB ni pole jo ma gen be maro ko kidong TB tika mako jo ma peti monyo yat HIV ma be chi mu pe monyo yat tiako kwera na TB mete owe neko ay mu kwero pimeo wache enti ma be paka kado dium ka ma dong iter no no kubu tum ki kome o paka we neko keta wan VSC watika no kede
dul magilungi ni luwe matunkumala wan watika logo madoko malaria ki madoko HIV ki tu TB pikomberi ni watika lok iko malaria matika nya red malaria don kumbeni olotwal perachutwal duonge tutwal kai nene kar me kot kit ene malaria yelo joma megwa pipero ni net mayam gi miyo bot gini poli dongo ye choko piano chwala kar maromo ariyo ang'ech malaria potholes nyo yo mogmano nok meno district tika yabone ena chamo kan pi chungo ko ye piano pegi toro gi mabe chi pi chungi kine kelo pero me malaria cases malaria oltwal perachutwal kimo karakech bebe pien ikin gang kumberi ni watigi health team ma kagin go pimo malaria chikilaro pien yedi bene gi miyo tipodgi gi pimo malaria kagi chako miyo yedi godan kin gang chi oltwal red malaria tika dugo pe.
I'm by the name Waka Benson, and I work with Northern Uganda Hip Hop Culture as the Executive Director. Today we are in Pandwong Health Center 3. We are conducting a workshop, a training, where we are engaging the health gatekeepers, that is the health technocrats and the district officials, at the same time the VHTs and LCs, and also religious leaders. What we are doing purposely here is just to see how are we fighting malaria? What is the prevalence of malaria? And we as Northern Uganda Hip Hop Culture, we are not treating, but we are doing what we call SBCC, that is Social Behavior Change Communication. And we are using it with the vision to see that by 2030, we reduced or eradicate malaria from Uganda, at the same time also fight HIV and TB. So literally, this is just a format that we are trying to see how can we engage all stakeholders from the grassroots to the senior technocrats at the district level, and also report at the national level. The finding, I'm so much happy that this time around, with the intervention that we are doing, malaria is reducing. That is a very good credit. But HIV prevalence is not reducing. HIV has increased. That is a very big challenge. The reasons are very unusual. We found out that some of the, community members, they use malaria test strip as a way of testing for HIV. We also found out that some other community members, who comes into employee community, business officials, they use this tactics of give me and I give you, which is a very big challenge in the community, and this is really causing alarm. And also, issues of GBV, at the same time also like the community members now getting used. They say now that HIV is a kind of normal thing to them. So I think, and TB is also something which is very still alarming. That is what I can say.